Hello, and welcome to another episode of MRCS Masterminds, the podcast where we dive deep into the surgical world, demystifying complex topics and offering practical advice to healthcare professionals and curious minds alike. I'm thrilled you could join us today. Today's episode is going to be a crucial one, especially for those who are on the front lines of patient care. We're talking about pain, what it is, how it manifests, and most importantly, how we can manage it effectively to improve the quality of life for our patients. We're going to walk you through the fundamentals, starting with what pain actually is, both from a sensory and emotional standpoint. But that's just the tip of the iceberg. We'll dive into medical protocols like the CCrISP system for patient assessment, discuss drug charts, and even break down immediate management plans for critically ill patients. From there, we'll take you through various pain management techniques, both pharmacological and non-pharmacological. Because let's face it, one size doesn't fit all when it comes to alleviating pain. We'll delve into the world of opioids, their benefits, and the potential risks that come with them. And yes, we will also discuss alternative options such as paracetamol and how to manage situations like toxicity. Moreover, we'll get into the nitty-gritty of pain scoring systems and patient-controlled analgesia. What do you do when a patient with severe post-operative pain presents themselves? How can you use the WHO analgesic ladder as a guideline? These are just some of the questions we'll be tackling. So, whether you're a practicing healthcare professional looking to sharpen your skills, a student prepping for the MRCS, or simply someone interested in the intricate world of pain management, this episode is for you. Stick around because you won't want to miss what's coming up. Let's get started. Welcome back, folks. As promised, we're diving straight into our first segment of the day, What is Pain?
Hello, everyone. I'm excited to delve into this topic with you. Pain is such a ubiquitous experience, yet when it comes down to defining it and understanding its nuances, we realize it's not as simple as it seems.
You're absolutely right. So let's start by laying some groundwork. How do we define pain?
Well, in medical terms, pain is generally defined as an unpleasant sensory and emotional experience associated with actual or potential tissue damage. It's that dual nature, both sensory and emotional, that makes pain a complex medical and psychological issue to tackle.
That's a good point. Many people often think of pain as purely a physical sensation. However, emotional pain can sometimes be just as debilitating or even more so.
Absolutely. For example, conditions like chronic pain can lead to emotional experiences such as anxiety or depression. The emotional toll of pain can, in turn, exacerbate the physical sensation, creating a feedback loop that's difficult to break.
So true. Now, let's talk about the concept of actual or potential tissue damage. This sounds like it's crucial for diagnosis and treatment. Can you elaborate?
Certainly. Actual tissue damage refers to identifiable harm to bodily tissues. Think of a cut, a fracture, or inflammation. This kind of damage sends signals to the brain via nerve pathways, indicating something is wrong.
That makes sense. And what about potential tissue damage?
Good question. Potential tissue damage refers to situations where there may not be an apparent physical issue, but the body perceives a threat. This can happen in conditions like fibromyalgia, where the pain is real but there's no identifiable tissue damage.
Wow, this makes it clear why pain management can be such a complex field. You're dealing with both the physical and emotional aspects, and sometimes without clear-cut indicators like tissue damage.
Exactly. And that's why a comprehensive approach to pain management is so vital. It's not just about dulling the sensation, but understanding the root causes and treating them holistically.
Well said. So that wraps up our first segment on defining what pain actually is, and hopefully this lays a good foundation for what's to come.
Absolutely. Stay tuned, folks, because coming up next, we're going to dive into the complexities of pain management techniques and the protocols that healthcare professionals use in various real-world scenarios.
That concludes our first segment. We'll be back shortly to continue this in-depth exploration of pain management. Thank you for tuning in. And we're back. Welcome to the next segment of our episode on pain management. In our last segment, we discussed what pain is, how to define it, and the importance of differentiating between sensory and emotional experiences of pain.
That's right. And now that we've laid the groundwork on understanding what pain is, let's move on to how healthcare professionals assess and manage it. After all, knowing how to accurately assess pain is crucial for effective management.
Absolutely. It's not a one-size-fits-all situation. So one method that is often used in healthcare settings is the CCrISP system of assessment. Could you walk us through that?
Sure, the CRISP system is a structured approach to patient assessment, particularly in critical care or emergency settings. It stands for airway, breathing, circulation, and disability.
Let's break it down then, starting with airway.
Right, so when we talk about airway, we're checking to make sure the patient has a clear path for air to enter and exit the lungs. If the airway is compromised, pain relief might need to take a backseat to life-saving interventions.
Makes total sense. The next one is breathing, I believe.
Yes, after confirming a patent airway, healthcare professionals will assess the patient's breathing, its rate, pattern, and depth. Inadequate analgesia can actually impair respiratory function, so it's essential to get this right.
Important point. What about circulation?
For circulation, we look for signs like tachycardia or hypertension that may indicate pain, but also could point to other underlying causes. The aim is to identify if inadequate analgesia might be causing circulatory issues.
So the next one, disability, sounds a bit broader.
It is. Disability assessment includes evaluating the patient's level of consciousness and other neurologic functions. For example, decreasing conscious levels might indicate opioid toxicity, which requires immediate attention.
Now, in addition to the ABCD system, there's also a full patient assessment checklist, right?
Exactly. This involves a comprehensive drug chart review, history taking, systemic examination, and necessary investigations like ABG analysis and chest x-rays. The goal is to ensure that the treatment is appropriate and effective for the patient's specific situation.
That's a lot to take in, but it sounds like a thorough assessment really is key to effective pain management.
It's critical. Every patient is unique, and without proper assessment, the chances of successful pain management are slim to none.
Well, that's a wrap for this segment on assessing patient pain. Coming up next, we're going to delve into the variety of techniques used to manage pain, from pharmaceutical solutions to alternative therapies.
You won't want to miss it, so stick around.
Welcome back, dear listeners, to MRCS Masterminds. We're progressing through our journey of understanding pain, and we have reached a critical juncture, the pain pathway. Are you ready to dive deep into the intricacies of how pain travels through our body?
Absolutely. Understanding the pain pathway is like unraveling a mystery. It allows us to comprehend how we perceive pain and how it affects us. To start, let's discuss the role of A delta and C fibers. These are essentially the messengers that transmit pain signals.
That's fascinating. So what are the differences between A delta fibers and C fibers, and how do they contribute to the pain experience?
Great question. A delta fibers are responsible for transmitting sharp, well-defined pain quickly. When you accidentally cut your finger, the initial sharp pain you feel is transmitted by A delta fibers. On the other hand, C fibers transmit dull, aching pain more slowly. It's the throbbing you might feel after the initial sharp pain.
So A delta fibers are like the sprinters, and C fibers are the marathon runners of pain transmission. Now, moving on, how do these fibers connect to ascending tracts, and why are they so important?
Exactly. The A delta and C fibers transmit pain signals to the ascending tracts in the spinal cord. These tracts are like highways that carry sensory information from the peripheral receptors all the way to the cerebral cortex. The dorsal column pathway, for instance, mediates touch and proprioception, while the ventrolateral spinothalamic tract mediates pain and temperature.
So, these ascending tracts ensure that the brain receives the signals and interprets them accordingly. It sounds like a well-orchestrated symphony of neurological activity.
It truly is. The brain then processes this information, and that's how we become consciously aware of the pain. It's a complex but incredibly well-coordinated system that allows us to react and respond to harmful stimuli, protecting us from further damage.
Incredible. This intricate pathway sheds light on why managing pain effectively is both an art and a science. By understanding the pain pathway, healthcare professionals can tailor pain management strategies to address the unique needs of each patient.
Absolutely. And as we continue in our next segment, we'll explore different pain management techniques and how they target various aspects of this pathway to alleviate pain.
Stay tuned, listeners. We have much more to uncover in the realm of pain management. I'm looking forward to delving deeper into this topic with you.
Same here. Let's continue unraveling the mysteries of pain together.
Welcome back, Masterminds. We're delving deeper into the multifaceted world of pain management. In this segment, we're going to unravel the complexities surrounding opioids, their side effects, and the innovative method of patient-controlled analgesia, or PCA. Shall we dive into the adverse effects of opioids first?
Indeed, opioids are powerful analgesics, but they come with their own set of challenges. The acute side effects include respiratory depression, nausea, vomiting, pruritus, and even delirium. However, long-term or chronic use can lead to more severe consequences such as dependence, tolerance, hyperalgesia, and even immunosuppression.
That's quite a list. It really emphasizes the importance of carefully considering opioid prescriptions. Health professionals must weigh the benefits against the potential risks and side effects. So, how do healthcare providers approach opioid prescriptions to minimize these risks?
That's a critical aspect. It involves comprehensive patient assessment, considering the type and intensity of pain, the patient's medical history, and potential risk factors for opioid misuse. Regular monitoring and follow-ups are also essential to adjust dosages and ensure the patient's safety.
A tailored and vigilant approach indeed. Now, moving on to patient-controlled analgesia, or PCA. Can you enlighten our listeners on what PCA is and how it's utilized?
Absolutely. PCA is a method that allows patients to self-administer controlled doses of pain medication, typically morphine, via a syringe pump connected intravenously. It's designed to provide personalized pain relief, and one of its key features is the lockout time, preventing overdose by limiting the frequency of administration.
It sounds like an empowering method for patients to manage their pain, but are there any limitations or challenges associated with PCA?
Indeed, while PCA offers individualized control, it does have some limitations. The patient needs to be alert and oriented to use it effectively. There can be challenges with equipment, such as battery issues, and it's not suitable for patients who are unable to press the demand button due to physical reasons. Also, mobility can be limited with PCA.
Great insights. And for our listeners' knowledge, what is the normal dosage of morphine in PCA?
The typical dosage for morphine in PCA is around 1/2 to 2 milligrams per bolus. It's essential for this to be closely monitored to prevent any adverse effects and ensure effective pain relief.
Thank you for shedding light on the complexities of opioids and the innovation of PCA. It's crucial for us to understand these aspects to navigate pain management effectively.
Absolutely. And as we move forward, we will continue to explore more aspects of pain management and real-world applications.
Welcome back to the final segment of today's episode, Masterminds. We've traversed a fascinating journey exploring the depths of pain and its management. For our concluding segment, we are diving into the various pain scoring systems used to assess and quantify pain. Could you kick us off with the verbal descriptor scale?
Certainly. The verbal descriptor scale is a subjective method for assessing pain, where patients describe their pain using a list of adjectives ranging from no pain to excruciating pain. It's a simple yet effective way to understand a patient's pain experience.
Simple yet significant. Moving on, how does the verbal numerical rating scale work and how does it differ from the descriptor scale?
The verbal numerical rating scale asks patients to rate their pain on a scale from 0 to 10, with 0 being no pain and 10 being the worst pain imaginable. It's a quantitative approach, allowing for a more objective comparison of pain levels over time, whereas the descriptor scale is more qualitative.
That makes sense. Now let's talk about the visual analog scale, or VAS. How is it utilized in assessing pain?
The visual analog scale is a graphic scale, typically a 10 centimeters line, where patients mark their pain level along the line, one end being no pain, and the other worst pain imaginable. It provides a visual representation and quantifiable measure of pain, helpful for tracking changes over time.
Intriguing. And for our younger patients, we have the Wong-Baker faces. How does this scale accommodate children's assessment of pain?
Absolutely. The Wong-Baker pain rating scale is designed with children in mind. It uses a series of faces depicting varying degrees of distress, helping children to visually communicate their pain level, making it more relatable and easier for them to express themselves.
A thoughtful approach for our little ones. And what about functional assessment? How does it fit into the pain scoring systems?
Functional assessment evaluates how pain is affecting a patient's ability to perform everyday activities. It's crucial for understanding the impact of pain on quality of life and guiding appropriate interventions and treatments.
Valuable insights. Lastly, could you shed some light on the Wilder approach?
Of course, Wilder stands for words to describe intensity, location, duration, and aggravating, alleviating factors. It's a comprehensive approach, offering a detailed picture of the patient's pain experience, which aids in crafting individualized management plans.
Thank you for enlightening us on these diverse pain scoring systems. Assessing pain is the cornerstone of effective management, and these scales and approaches are instrumental in achieving that.
Absolutely. It's been a pleasure exploring the multifaceted world of pain management with you and our listeners. We hope this episode has shed light on this crucial aspect of medical care.
And that brings us to the end of this episode, Masterminds. We hope you found it informative and enlightening. Stay tuned for more episodes exploring the world of surgical sciences. Until next time, keep learning and stay curious.